Good evening, everyone. I'm Trish O'Neill, the National Director of the Chapter Development for the National Pancreas Foundation. Welcome to the National Pancreas Foundation's webinar. Tonight's session is presented by the NPF Center of Excellence, the UCSF Benioff Children's Hospital panel of experts. Our topic this evening will be supporting families with pancreatitis and who do you need on your team. Please use the Q&A section of the portal to submit your questions, and they'll be answered at the end of tonight's presentation. The National Pancreas Foundation provides hope for those suffering from pancreatitis and pancreatic cancer through funding cutting-edge research, advocating for new and better therapies, and providing support and education for patients, caregivers, and healthcare professionals. Please consider taking an active role in furthering the mission of NPF by sharing your story with us, supporting our National Pancreas Bowl fundraiser, making a donation on Giving Tuesday, or joining a chapter in your local community. To learn more, visit our website at pancreasfoundation.org and be sure to follow us on Twitter, Facebook, and Instagram. Together, we can provide hope. Our moderator this evening is Dr. Emily Perito. Emily Perito is an associate professor at UCSF who specializes in the care of children with pancreatic and liver diseases. Her clinical care and research focus on optimizing long-term outcomes for children and pancreatic and liver diseases. Dr. Perito is a co-director of the UCSF's Pediatric Pancreas Program. She leads UCSF's work in the NIH-sponsored multi-centered trials, including the INSPIRE study on acute, recurrent, and chronic pancreatitis in children and adolescents. Her work in chronic pancreatitis includes research on chronic pain management, opioid use, and outcomes after a TPIAT. So thank you all for joining us, and I'll turn it over to you, Dr. Perito.
Thank you. Can you guys hear me okay?
Yes.
Okay. Well, welcome. I'm really excited that our team could join you tonight. I am here as well as a really important member of our team, Dimitra Farmas, who's going to talk later in the session. And we apologize that we're missing one really central member of our team, who's Michelle Klosterman, who's the nurse practitioner that helps us run the Pediatric Pancreas Program. And she's really at the center of a lot of the care that we do. So I'm going to be standing in as well as I can for her tonight. So I'm going to go ahead. And we're going to start tonight by talking about how we support kids and families living with chronic pancreatitis and the team model of care that we've been lucky to be able to develop at UCSF and Pediatrics. I'm going to talk to you a little bit about how that team functions for us. It looks different at different medical centers, but we feel like the parts of our team are really important to providing the best care that we can for kids and families that are living with chronic pancreatitis and other types of pancreatitis, given that it can be such an overwhelming and ongoing and unfortunately still incurable disease. These are the other folks that are on our pancreas team, and I'll talk a little bit more about several of their roles today. Our UCSF Pediatric Pancreas Program was launched as a coordinated effort in 2015, although actually most of these providers, including folks in GI, pain management, endocrine, surgery, and advanced endoscopic procedures, as well as mental health support and teachers, have been with us for longer than that. But in 2015, we really recognized that there was an unmet need for coordinated expert care for children with chronic pancreatic diseases. And we developed the shared goal of coordinating and elevating the multidisciplinary expertise provided at UCSF in the care of these children with chronic pancreatic disease and the care of their families. I want to talk just a little bit about the other teams we work with that I think are really important to advancing care of kids and families with chronic pancreatitis overall. The INSPIRE study group, which is a prospective research study, including the centers that you see highlighted here, has been really important for building our understanding of this disease and helping us think about how we can improve it. There are 22 sites, mostly in the US, but actually across the world. We've enrolled over 600 kids and teenagers in helping us sort of follow their courses forward so that we can understand what this disease does and how to mitigate its effects. So this is another important, bigger team that we work with. Oh, excuse me. And then, as you know, there's other important partners for the team, again, for really extending the work that we do past the center into other centers and into the advocacy and research community, including the NPF, who is kind enough to host us here tonight, as well as Mission Cure, another patient advocacy organization. The NIH and NASPGHAN is the Pediatric GI Society that's put out a lot of the guidelines about really the best evidence that we have so far for taking care of kids with this disease. As many of you probably know, chronic pancreatitis in children and adolescents is a rare disease, but has a big impact on the people that it affects. The median age at first pancreatitis attack is not quite 7 years of age. And again, as many of you know, it's a painful chronic disease that often requires frequent hospitalizations. Over half of patients report constant pain. Somewhere just under a third develop pancreatic exocrine insufficiency and need enzymes to replace that function of their pancreas, which we'll talk a little bit later about tonight. And about 6 to 8% develop diabetes even in childhood, with that prevalence unfortunately increasing over time. What causes chronic pancreatitis in children? Again, these may be familiar to many of you, but just as a reminder, on the left, you see some of the common genetic mutations that cause this disease in kids. And I think this is important to mention here because we know that when we detect these mutations, that means that this is going to be a disease that both the kids are going to be living with, that they were born with and will be living with throughout their lives. And also that for many of these genetic mutations, they may affect other people in the family and require that they get appropriate care and counseling and screening as well. There are also other things like the anatomy of your pancreas or autoimmune disease or medications that can cause chronic pancreatitis in kids. And so really using our multidisciplinary team to develop personalized care for each kid, each of whom has a slightly different cause of their pancreatitis is really important. So when we think about the challenges of pancreatitis for children and their families and caregivers, as well as those of us on the healthcare team that are working to help make their lives better, they are many, as you know. We think about really the lifelong burden of chronic disease, especially the chronic pain, as well as the unpredictable and painful flares. We, have learned just how difficult that is for kids and families to be wanting to live their life, even sometimes with some pain, but really have it, repeatedly disrupted by pancreatitis flares. We know that unfortunately now there isn't a cure for this disease, except for removing the pancreas, which I'll talk a little bit more about later on. We know that there's a risk of having so much damage to your pancreas that you can lose your exocrine function, which is your digestive enzymes, and you can lose your endocrine function, which leaves you with diabetes. And we also think about the risk of pancreatic cancer caused by some of the genetic mutations, which thankfully happens not so much in childhood, but it is a risk for adults. We know it's stressful and traumatic for the child and family, both to experience the symptoms and to have these overlying worries about what the disease might carry in the future for them. Particularly, the fact that, as I said, a lot of this is hereditary and has, particularly with PRES1 and SPINK1, some of the more common genetic mutations, it's what we call a dominant pattern, where you just have to inherit one gene that can cause the chronic pancreatitis from one parent. And so having multiple family members either affected or as gene carriers, having the risk that they might be affected in the future can, again, I think adds a lot of stress to the just already issues with living with this disease. And then we know that the pain and the flares and the procedures that you have to have really can impair quality of life and function, both for the child, for the parent who's missing work, and for the family overall who's dealing with these repeated disruptions. So what are our team's goals for treating kids and families who are living with chronic pancreatitis? Well, we would like to help with pain relief or having as many pain-free days as possible. We want to help improve their daily function, to help kids get to school and do the activities they enjoy, to help parents get to work, and to help the family function overall. We want to try to preserve their pancreatic function, that exocrine and endocrine function that I mentioned before. Really try to minimize the emotional effects of living with this disease, and again, all the different things that it brings with it. Minimize the trauma that they experience in the healthcare setting and outside of it related to their disease. Try to prevent narcotic dependence. This is something I know a lot of kids and families and other adults have been thinking about in the face of the opioid epidemic that's really overwhelmed the United States. is thinking about how we can effectively manage pain and treat it appropriately, but also still be careful about, what that means for dependence on pain medicines going forward. And then really try to improve quality of life for the child living with pancreatitis, as well as for the entire family. Oops. So for us, support for the child and family by a multidisciplinary team is really critical. And again, I'm going to talk to you about the structure that we have at UCSF and the specialists that we draw on to help us with the care. This can be a little bit different in terms of which families need which resources and services, but it's really nice to have them available and be able to draw on them. And again, really work together in understanding what's best for our patients over time, we have found. A really important part of our team is our mental health support, which comes from multiple people, including Dimitra, who will really focus more on how we do this later tonight, as well as our social workers and folks on our pain management team. We do have what we call IP3, or an integrated pain management team that includes hospitalist pediatricians who specialize in pediatric pain management, anesthesia docs who can help with nerve blocks and other slightly more intensive procedures for managing pain, as well as psychosocial support from a psychologist, social worker, and nurses, again, to really help with the effects of this pain on the child and the family. We monitor exocrine and endocrine function over time. I'll talk a little bit more about that going forward. And so GI, of which I'm a team, as well as our endocrine team, are really important members of that. And really in terms of thinking about both preventative care as well as treatment over time. For interventions to improve pancreas drainage, we call on our colleagues who do our ERCPs, as well as interventional radiology and surgery. We work closely with the genetic counselors, especially for those kids with hereditary pancreatitis. And we really think about the importance of getting parents or grandparents or other family relatives, family members screened, especially for PRES1, as that's really the one that's known to cause a risk of pancreatic cancer over time. And so really starting with the child and then working out to the other generations to make sure that folks are getting appropriate diagnosis, and screening is an important thing that our team thinks about. And then especially for patients that are inpatient, the child life specialists are really helpful to us. They do play therapy and art therapy and procedural preparation for kids to really help, again, minimize trauma, figure out what the preferences of kids or families are, and try to make things less stressful and less anxiety provoking over time. A little bit more about our integrated pain management team. These are pediatric providers with, as I said, expertise in managing pain. They can see patients both inpatient and outpatient, and that's really helpful for preparing for procedures or helping when chronic pain lasts beyond the time that you're in the hospital. And really enable us to offer a wide range of options that includes medications like oral, IV, and topical medications, but also other adjunct therapies that can reduce the need for medications. This includes something called TENS, which is like an external nerve stimulator, which can be really helpful for folks with chronic pain. Other methods like acupuncture, mental health support, and nerve blocks. Again, as many of you are probably familiar with, ERCP is an endoscopic procedure that can help improve pancreatic drainage. It can help open up strictures or blockages and take out stones. And so we actually, different teams do this different ways, but at UCSF, there are what we call advanced endoscopists, or folks who do mostly ERCPs all day, most days, and so are really expert in this procedure. And so for us, our multidisciplinary team helps take care of the child through that ERCP procedure, including the GI folks kind of overseeing care, the anesthesia docs helping with pain management, and then the endoscopist doing the actual procedure. And I think, this takes a lot of coordination and really getting to know the patient and the family over time to make sure that it can run smoothly with having so many different folks involved. But for us, having a multidisciplinary team where people are doing this repeatedly together over time has really helped us develop processes and procedures to do this smoothly for folks. This is just a little bit more about what ERCP can accomplish. In the upper left-hand corner, you see what the X-ray pictures look like and a dilated duct of a child with chronic pancreatitis. The ERCP enables us to use through the endoscopy some tools like a stent, which you can see on the right side of pictures, that help stent the pancreatic duct open and facilitate removal of stones, as well as we can open up the papilla, the connection between the pancreatic duct and the intestine, to help, again, that drainage over time. And this can be a very helpful procedure for treating folks, or sort of helping mitigate the pain of folks with chronic pancreatitis, but is difficult because it, in and of itself, it can cause pain to have this procedure. So again, I think having our team that knows this patient help them through the procedure when they need to have it is a really important part of what we do. And we know that sometimes ERCP is really helpful in patients with chronic pancreatitis. This is data from the Inspire network that I mentioned before, in kids all across the country at many different centers who have ERCPs. And what we saw is that with various different types of procedures done during ERCP, about half of patients will have some relief. But that leaves the other half not necessarily feeling better after an ERCP. And so again, thinking about how do we manage that pain and what do we do next if an ERCP is not working, is really important for us to think about. We also rely on our multidisciplinary team to help us if medical or endoscopic management is not successful. And we are fortunate at UCSF to be able to offer what's called a TPIAT, which is a total pancreatectomy with islet auto transplant. You'll hear from one of our families that's been through this procedure later on. And I wanted to talk a little bit about this because, again, I think it's a really important example of where having the multidisciplinary team work together with the patient, both before, through, and after this procedure, is really critical to it going well. You can get some sense of what happens during this procedure from the pictures I'm showing here. You see in the picture on the left at the beginning, the areas in gray, including the pancreas. This one's for a pancreas tumor, which most of our patients don't have, but just as an example. But the pancreas, a small part of the small intestine, as well as the gallbladder and part of the bile duct, are all removed during this procedure. So as I mentioned before, this is kind of the one cure that we have for chronic pancreatitis because it takes out the pancreas. But that also makes you lose your pancreatic function. And so what we're able to do is send the pancreas to the lab and purify out the islet cells, which are the cells that make insulin and control your blood sugar, and infuse them back up into the liver. So it's big surgery. It involves obviously the surgeons, the anesthesia docs for pain for management both during and afterwards, as well as the endocrinologist to help with the effects of those islet cells, and the GI team who oversees care, and then just the mental health support to really prepare the child and family for what it's going to be like to go through this procedure, and then to help with recovery afterwards. But for those patients who are really stuck with medical and endoscopic management not helping, it can be a really life-altering and very helpful procedure that can really improve quality of life afterwards. When we are thinking about TPIT, we're thinking about providing pain relief, improving quality of life, really making it so that not so much of your life is lived in the hospital or in the emergency room, but that you can go to school, that parents can go to work, that kids can be involved in the activities that we want to be involved in. And what we find actually means a lot to a lot of our families is just getting rid of the uncertainty that that pancreatitis flare might come back anytime. And that is really relieving to a lot of folks for whom this is the right choice. The goal is to preserve insulin function as much as we can by giving back those islet cells, wean folks off of narcotics, and decrease the risk of cancer over time. So when do we consider this? Again, this is really usually a very multidisciplinary decision for our team, and we have a pretty formal process of evaluation and discussing with the family and with the team about whether this seems like the right choice for a patient. But when somebody's really having frequent hospitalizations and chronic pancreatitis, when they're missing school or avoiding activities because of the symptoms of chronic pancreatitis, when they're starting to lose islet cells, and we look at different tests for that, when they're not improving with either medical or endoscopic management, and especially when we know if this is genetically inherited, that there's a risk of this going on, for the rest of their life. then for patients who end up with this, TPIT can be a really good option. So how do we help kids and families through this process? As I said, it takes a team and a lot of communication. And I'll again credit Michelle, our nurse practitioner, who I think is at the center of this web with the patient and family, really trying to help coordinate care. But as you can see here, it's really a lot of teams that work together to plan this procedure and prepare the child and family to get them through the actual hospital stay, and then to continue to take care of them afterwards. And so, you know, as we have gone through this and really developed processes for how we communicate about it and how we prepare the patients, we actually have like a written plan that gets delivered to every patient's bedside in the ICU that involves personalized plans from each of the teams to really help make it clear to all the different folks in the hospital about how this is going to run. I think it has really helped both the patient and family experience, as well as our medical management over time. A little bit more about the multidisciplinary evaluation and education. Families and kids meet with a pancreas and GI team, which is me and my team, with the endocrinologists and the diabetes educators, who really walk the family through the hands-on process of what it's going to look like to use use insulin after the procedure, because everybody needs insulin at least for a short period of time afterwards, as well as the surgeons, our mental health and social work teams, to help plan, like, how do you take this chunk out of your life to be in the hospital recovering from this, and then pain management team. And we have a series of teaching sessions that go either video visit or in person, depending on the family's needs, again, to really help make sure they're prepared and make sure we understand what the patients and families' needs are going to be as they're recovering from this surgery. And the goal of this is really to provide as atraumatic as possible and coordinated care to the patient and their family. So again, I think we're really grateful to have this team that we built over time, and to be able to work together and taking care of patients, given what a complex disease it is. And even though it's centered in the pancreas, I think we really continue to learn about how much else it affects both within the patient and within the family, and really trying to address those issues and care for them over time. We hope makes a big difference to the families that we take care of. Okay, I'm gonna stop this part and put up my other share. Again, usually it would be Michelle who's talking about this next topic. So I'll just take 1 second to put this up. Sorry. So Michelle Klosterman is the nurse practitioner that helps run our pediatric pancreas program. She is both a pediatric nurse practitioner and a registered dietitian. And so one of her areas of expertise is optimizing growth and nutrition in children with chronic pancreatitis. And so I wanted to go through with her inspiration some just really practical advice about what families can do and what providers can do, even if you're not in a program where you have a multidisciplinary team that we are fortunate to have, to really make sure that we're optimizing growth and nutrition in children with chronic pancreatitis is really my area of expertise, but I think this probably applies more broadly as well. So what does your pancreas do for you? As we talked about, your pancreas has 2 functions. One is your endocrine function. That's the islet cells shown on the left, as well as some of the other cells that work with the islet cells to control your blood sugar. And the exocrine cells in your pancreas, which are called acinar cells, make digestive enzymes that are secreted out into the branches and the main pancreatic duct down into the intestine, and help you digest your foods, particularly fats and proteins. So when we think about optimizing growth and nutrition, it's really important to think about these 2 functions of your pancreas and how we might both understand and support them in people with chronic pancreatitis. This just shows a little bit more about the exocrine function. Again, I think really important to know that these digestive enzymes are created inside the pancreas, but then they're supposed to be secreted out the pancreatic duct into the intestine. It's thought to be these same digestive enzymes, when they get stuck inside the pancreas, that cause inflammation and a lot of the pancreatic injury and pain associated with pancreatitis. Once they're in the intestine, they get activated and do what they're supposed to do, which is help you digest fats and proteins. So what happens in pancreatitis? What happens if pancreatitis causes a lot of damage to either one of these cells? Well, for the endocrine function, we know that if you lose too many islet cells, your body can't make enough insulin and can't control your blood sugar, and that condition is called diabetes. And for your exocrine function, we know that if you lose too many acinar cells, your body can't make enough digestive enzymes to help you absorb the nutrition that you're eating, and you develop what we call exocrine insufficiency. So why are people with chronic pancreatitis at risk for poor nutrition and growth? Well, certainly the pain and nausea that comes with pancreatitis flares or chronic pancreatitis can limit appetite and limit intake. If you develop exocrine insufficiency, which can be sort of complete exocrine insufficiency, but often can sort of evolve slowly into more of an insufficiency over time and may not be detected right away, then you may not be able to absorb all the nutrients from your intestine, especially fats and proteins. And I'll talk a little bit more about fat-soluble vitamins later on. If you have endocrine insufficiency, as I mentioned, your body can't make enough insulin to use sugar and carbohydrates effectively. You can have symptoms like nausea and abdominal pain related to that. And then, you know, again, as many of you probably know well, unfortunately, we ask you to do frequent procedures or you have frequent hospitalizations where you end up limiting eating or drinking for days, and it can be really easy to get behind in nutrition. So really important, you know, again, as part of a chronic care to really be thinking about how to optimize this when you can. So what can you do to optimize nutrition and growth for your loved one or yourself who's living with chronic pancreatitis? So one thing is to optimize management of the pancreatitis to reduce pain and flares. And if possible, consult with a multidisciplinary pancreas team who really specializes in this. Make sure you have the diagnostic testing to really understand what's contributing to the pancreatitis. Make sure there's adequate imaging to look for pancreatic stones or strictures, and that, you know, sort of evaluate whether ERCP might be helpful to improve the drainage from the pancreas, because that really can help with pain and flares in some patients. And then try to access pain management and mental health support to really address the stress and anxiety caused by chronic pancreatitis, because that sort of stress and anxiety, I think, can definitely contribute to making the pain and the nausea worse for a lot of people. Get testing to see how well your pancreas is working now. Again, sometimes the symptoms in this are obvious, but often early stages of this are not obvious. And so there are pretty non-invasive ways that we can test pretty reliably to see how well the pancreas is working in both of these two domains. For islet cells and thinking about the endocrine function, we can check fasting blood sugar and insulin, as well as what's called a hemoglobin A1C, which is an estimate of how your blood sugar has looked over the past 3 months. And then we can also check how your pancreas reacts to stress. So this is called an oral glucose tolerance test or a mixed meal tolerance test. This is the same test for women who get screened for diabetes during pregnancy. You have to go and get your labs done, and then you drink some juice, and then you get your labs checked again. Same idea. And this, so, you know, a relatively easy test that we can use to check early changes in endocrine function. For exocrine insufficiency, the best and easiest way to do this is with a poop sample. We call it fecal elastase or pancreatic elastase, and it measures one of the digestive enzymes that your pancreas is to secrete. There are also endoscopic ways to test pancreatic function that can be more sensitive and are appropriate in some situations. And in our program, we reassess once a year in people with chronic or acute recurrent pancreatitis to, again, make sure that we're picking up any early stages of this and really try to make sure that folks are getting the appropriate screening and treatment if these do develop. We really encourage folks to aim for an age-appropriate balanced diet, and there are lots of resources that can help you do this. I put up a couple of them here. myplate.gov sort of gives a good idea of how to balance different things when you're actually putting a plate together, and there's a lot of very kid-friendly resources on that. Healthychildren.org is another one from the American Academy of Pediatrics that has very concrete resources on how to provide enough fat without overdoing it for kids. And then I did want to just put in a little plug for the NPF's Healthy Family Recipes for Pancreas Disease. This is a really nice recipe book that gives really good examples of healthy but also good recipes, and you can download it online at this link. In terms of more specifics, to think about that we usually recommend not really restricting fat intake, especially in kids. We want to be careful that we're not overdoing it with fried foods and fast food every day, but it is really important for kids, particularly preschool and elementary school age kids, to get enough fat and protein to support the brain, muscle, and other development. Ask your healthcare provider if you can meet with a nutritionist. They can help you think about what the right balance is for you or your child. And if you are going to do this, I would strongly recommend keeping a food diary just for a few days. If you can record everything you eat and drink for 3 days before the visit, then that can really help the nutritionist provide more personalized recommendations to you. Help your child learn their body. Are there certain foods that cause more pain? Some of our patients really find that they know when this is going to happen, and they can learn to stay away from some of those trigger foods over time. And then, as I mentioned, check out the NPF recipe book for ideas. So think about whether pancreatic enzyme replacement therapy might help. So pancreatic enzyme replacement therapy, or we call it PERT, are pills. I'll show you some pictures on the next days that contain enzymes that would otherwise be made by your pancreas. These are used by some, they're used definitely in patients with pancreatic insufficiency, where their pancreas is not making enough support enzymes to support digestion. You definitely need PERT in that case to support digestion, make sure again that you're adequately absorbing the fats and protein that you can take. And actually, if you have exocrine insufficiency, it can cause a lot of diarrhea and bloating and stomach discomfort, and the PERT may make you feel better, in addition to supporting your nutrition. Sometimes pancreatitis patients who do still have exocrine function are prescribed PERT to try to decrease the work of their own pancreas and let their pancreas rest more. It's not easy. You have to take the pills with every meal and snack, except non-fat items, or if you're on a clear liquid diet in the hospital. And so it can really be a burden, but in some patients, it is really helpful for managing symptoms. So it's something to think about and ask your provider about whether it might be helpful for you. And then proton pump inhibitors, which are reflux or heartburn medications, many of which are available over the counter, are often given to help the PERT work better. This is especially important after TPIT, because without a pancreas, your stomach acid isn't neutralized by bicarbonate for the pancreas. So I think just to say that there is a lot of fine tuning that can be done in patients who are on PERT, and to really help make sure that it's optimizing both your nutrition and any symptom management that it's helping with. This is what the pills look like. Some of them can be opened for kids who aren't able to swallow capsules. So there's a lot of different options. Number 5, take it easy on your islet cells. Try to maintain a healthy weight for your body. Being overweight causes insulin resistance, which means your islet cells have to make more insulin to achieve the same blood sugar control. And insulin resistance is something that develops before diabetes. So your body's need for insulin can overwhelm your islet cells, and they can't make enough to control your blood sugar. So by keeping your body at a healthy weight and trying to avoid being overweight or obese, that can decrease the amount of insulin that your body needs to function well. Try to avoid excess sugar, especially drinks with a lot of sugar in them, like soda or sports drinks or fruit juices. The body processes the sugar really fast, which can be a stress on the pancreas. And then exercise regularly. Aim for 60 minutes daily. Moderate to vigorous exercise can really improve your body's ability to respond to insulin. Number 6, get your fat soluble vitamin levels checked and replete them if needed. These are vitamins D, E, A, and K. Vitamin D deficiency is very common in almost everyone, and can cause problems for bone health in particular later on. But these vitamins, you're especially at risk for being low on in people with exocrine insufficiency. And so often those folks require a special formulation of the vitamin in addition to getting it from healthy foods in your diet. And so that's something to just make sure you have checked and think about with your provider, whether you need to replete any of those. So these are some recommendations for trying to optimize growth and nutrition in kids with chronic pancreatitis. Again, I think everybody's a little bit different, so trying to work with an experienced team that can help you really optimize things is great, and really can help over time. But keeping these principles in mind, I think are some sort of feasible and hopefully practical tips to help. Okay, I'll go back to just my team one more time and then hand things off to Dimitra Farmas. Dimitra is a really important member of our team. She is a licensed child and family therapist, and she helps us take care of the kids and families in our practice. So Dimitra, I'll hand it over to you.
Great. Thank you so much, Emily Perito. That was a lot of information and great information. I am going to do a share screen here. So give me a moment. There is a question. I don't know if you want to address that now or.
I can answer. I'm going to answer it in the chat, so you can go ahead.
All right. So sorry, you probably could see everything right now. I'm just going to go to presentation. All right. Can you guys see that okay? All right. Thank you so much for having us come on here and talking to you guys a little bit about chronic pancreatitis and something that I've been working on. Let's see, I started working with UCSF, Benioff Children's Hospital about 4 years ago, coming up on 5 soon. And one of the things that comes up with families and patients that are dealing with pancreatitis is coping with stress. This is a lot going on. Could be really hard for patients, for their families, and really working on maintaining, optimizing function in their lives, being able to go back to school, being able to go back to work, and do all the things that kids love to do. So why can't I move forward? Okay, hi, there we go. Okay, so a few things I'm going to touch on today. We're going to talk about why are we talking about mental health? Just hearing Dr. Perito talk about all these things and everything going on with your pancreas and what pancreatitis is, and so many things to take into account with endocrine and your diet and all this other stuff. Like, why are we even talking about mental health? I'm also going to talk about what are some common stressors I've seen working with patients and their families. I want to touch a little bit on what medical trauma is. We are becoming a little bit more trauma informed, and something that comes up is that when you are readmitted to the hospital over and over again, there could be some traumatic events happening. I also want to talk a little bit about the mind-body connection, and this is helpful with mental health and making that connection with symptoms that you have with pancreatitis. And then I'm going to talk a little bit about day-to-day tips that could help you function, and hopefully something that you guys could take away today. Okay, so why are we even talking about mental health? Mental health in the last 10 years, I want to say, has been a forefront for all children, especially after this global pandemic. So many people are so worried about the emotional, psychological, and social well-being of our kids and children and everyone, right? This has been a stressful time. So as you know, someone dealing with a chronic illness, any chronic condition, it makes functioning, living a lot harder. You're faced with challenges that a lot of people are not faced with. So you are dealing with a lot of stress, and addressing mental health is important. And what I absolutely love about our team is that we are addressing the whole child. So of course we're addressing pain, pancreatitis, and everything that comes with the physical pain, but also addressing everything else that comes with that, which is a stress. So some of the stressors that come up with pancreatitis, some of the, not for everyone, for a lot of people though, is that there's oftentimes it's not very clear what the outcome will be. Sometimes providers will tell you, oh, this could help, maybe not, let's try this, we're gonna try things out, and that could be very stressful. Things that are unknown, and then suddenly not being able to do things that you may love. I have a lot of patients who are not able to do physical activities like they used to, things like playing soccer, playing basketball, being able to do their dance that they love to do. This is really hard, maybe not eating things that you used to love eating. So facing new limits. We also deal with people dealing with pancreatitis, deal with not being sure about the future and what's going to happen with school. They start to worry about their academics, what's going to happen with work. Are they going to be able to work in the future? And it also has an impact on your relationships, your partner. Pancreatitis can sometimes get in the way. And I also have a funny little drawing here, a comic of a pancreas sitting with a couple there. I thought that was kind of funny. Another thing that comes up is depressive symptoms. Sometimes you will feel sad, feeling of helplessness, feeling of guilt, this feeling that I'm causing stress, not just for myself, but for my whole family. There's also the feeling of loneliness and isolation. And I think this came up in one of the questions, is that not many people know about pancreatitis, are not very familiar with it. So sometimes talking about it, people don't know what the condition is. So it feels like no one else has it. And then, and again, going back to what the question, feeling unheard or unseen, because sometimes providers don't always know what is going on. And it takes a little while before you might even get diagnosed with pancreatitis. And in the meantime, how incredibly stressful that is for the patient and for the families. And there's also medical trauma that comes with simply just even experiencing pain, pancreas pain, that could be traumatic in itself. Things such as repeated hospital visits, procedures that have to happen, those are all very stressful and could be considered traumatic for the patient and for the families. So what is medical trauma? Pediatric medical trauma, traumatic stress. This is something that came from the Natural Child Traumatic Stress Network, a set of psychological and physiological responses of children and their families to pain, injury, medical procedures, and invasive or frightening treatment experiences. Something such as, which I hear often, is needle phobia, due to having to have an IV placed, getting blood work drawn, and being poked repeatedly. Suddenly we have a fear of needles. Also, coming to the hospital, children suddenly remember what it's like being in the hospital and they do not want to come back. They are fearful of entering the hospital again, being in touch with even medical providers. They don't want to see anyone from their team. So this could be something, and the reason why I bring this up is that it happens more often than we think, and it doesn't have to be so traumatic in a way that I know people have had medical traumas where it's near death, and that's obviously very traumatic, but trauma could be being worried about not waking up after anesthesia. Again, just basic things that happen in the hospital could be very stressful for children. It could be anything that's distressing for them, even if we think like, oh, this is no problem. You know, you've had a shot before, that could change very quickly if it becomes stressful for them. So what are some of the symptoms look like if your child is dealing with medical trauma? Again, the fear of coming to the hospital, fear of doctors, medical providers, anyone at the hospital, Physical sensations. This is hard because you already are dealing with pancreatitis, but you may, there's sometimes patients have reported that they're doing great until the day they have to come into the hospital and they suddenly have some symptoms that they're experiencing. And that's usually due to knowing that they have to come back to the hospital and worried about what may come up for them. Intrusive thoughts, things that come up for them and they are thinking about it often and they talk about it a lot. This is where, again, therapy would be helpful, being able to process some of the things that they've gone through. Nightmares, suddenly kids waking up with nightmares, any disruption in their sleep could be a symptom. And then hyperarousal. This is the feeling of feeling that you are not safe. And so everything kind of becomes super sensitive. You're aware of everything. And this is something else, just like PTSD. Medical trauma is very similar to that with the symptoms. So things to keep in mind, because this is common in a lot of children with medical conditions. And so just a few tips before I move on. I just want to bring up that recognizing that the trauma is real. I think we do this to ourselves too. We often downplay trauma. Oh, I'm going to be okay. That was not a big deal. It's fine. It was a little scary, but I'm fine. Being able to recognize that it is something scary. And we often do this to kids too, where we will say to them, you're going to be fine. That was not that big of a deal. You're going to be okay. Maybe talk to them like, yeah, this is really scary, huh? Like, let's talk about what this was like and why this is scary. What was that like for you? Things like that could be helpful for the patient. And definitely if you do have any fears or there's any anything that comes up for the patient, please communicate that to your medical provider. They will do anything that they can to lessen or make it easier for the patient to continue with their treatment and procedures, possibly bringing in a child life specialist where they could help explain a little bit more what the procedure is like. They also help with distracting the patient, just making it as easy as possible and making them as comfortable as possible before having to go through another procedure or hospitalization. I put down play therapy because I think if you're working with young children here, like this little person here in the picture, it's really helpful having kids play with medical tools, something that they could do at home, pretend that you're the patient, have them be the provider and have them, fix your pancreatitis. And oftentimes that will have the child, act out some things that come up for them. I had one mom who I suggested getting a medical play kit to bring at home and to use that. And when I checked in with her again after how it went, she was explaining to me that when she was a patient, that she took, good thing it's plastic, took the plastic needle and was jabbing her arm over and over again. And she was so surprised. And she was like, "Ow, that really hurts. It's really hard." Like, "Why are you hurting me?" And she's like, "This is what it's like to get poked over and over." And just having kids process that is really helpful. And of course, therapy, any mental health services will help you with medical trauma. And I'll talk more about therapeutic services. I also wanted to touch base on what mind-body connection is, because this is something that that I talk a lot about in therapy with my patients, and having that connection of what is going on in your body and how that is connected to how you feel. So, and having that connection, is helpful for patients to understand what is going on with them and giving them a sense of, I don't want to say control, but a sense that they know what their feelings are and what can they do to improve their mood or their thoughts around some of the symptoms that they have, right? Which is usually around pain or nausea. So this is really helpful. This is something that, again, you could work on at home, even if you did not have a mental health provider to work with your child every week or every so often, having some awareness to your attitude towards pancreatitis and your medical condition. So why is this important? It has an impact on your condition and your physical health. So I put here, this is something actually that our pain psychologist who works with our team brings up, kind of understanding the pain, the stress, and the cycle that comes up when we're dealing with that. So our behavior and quality of life impacts the stress and pain that we're dealing with. A strong mind-body connection is helpful with your anxiety, fatigue, improving digestion, all these things. One of the therapies that I use is CBT, so cognitive behavioral therapy, and that brings attention to your thoughts and feelings and how that impacts your behavior and what you do. So if you are in pain and you are avoiding school or avoiding things, and how that impacts then also the stress in your life, and going right back to the pain that you are dealing with. So I just want to talk a little bit about what are some things, some tips that you can do to improve your mental health and your day-to-day functioning. So of course, like Dr. Perito brought up, just being able to connect with your team members, connecting with your primary care team, getting some insight on what kind of mental health is available to you, talking to your GI, social worker, your pain psychologist. All these people could be a lot of help for you, child life specialist to help you in the hospital. And of course, a psychiatrist if you feel like more assessments and medication is needed for the patient and family members. I talked a little bit about CBT. This is something that is helpful when dealing with chronic conditions. This involves challenging some of your thoughts that you have and how it impacts your behavior. So this is a type of therapy that is helpful. And some of these things that could be done at home to help relieve stress. This is something that is helpful for all kids, I think, not just kids with chronic condition, but especially so, is that you can do some of these things at home. They're working, I think, at school on this too. There's a need for social emotional learning and growth mindset. These things that you could even find on the internet. I think on YouTube, they have guided imagery, visualizations. You could do hypnosis, listening to someone to kind of bring you to a deeper state of relaxation. Meditation, mindful movement such as yoga. And then we also have, I always recommend that my patients do some journal writing or gratitude journal. This helps with just being able to process a little bit on your own at home, but also when you're thinking about things that are working great for you or things that you are happy for, it just improves your mood. Another thing that is helpful for kids that have pancreatitis, progressive muscle relaxation. This is something that you could also find probably on YouTube. And this is a way of working through different body parts and relaxing a certain area and then releasing it. And that has shown to help with dealing with pain and helping you relax a little bit more. And these are all ways to calm your nervous system. And when you're calming your nervous system, you are relaxing a little bit more and hopefully decreasing a little bit of that pain or nausea that you might have from pancreatitis. Another thing I do with young kids is I'll read some books about hospital visits, about any condition, and this gets young children talking about what it's like having a chronic condition, what it's like coming to the hospital, anything that will encourage talking, and books that you could find, again, probably on YouTube, but on the web, you could find things talking about hospitals. And this just encourages children to talk a bit about their experience. Okay, so I am going to move on here. I think this is time. Oh, I think I have one more. Sorry, for some reason. Here we go. Okay, so one thing I recommend for families and patients to think about people who are helpful to you, who are people that you could reach out to, who are people that you like talking to when you're feeling stress. I ask the patients to do something called a circle of closeness, and they talk about who their go-to is at home, at school, who their friends are that they go to, their teachers, whoever it might be that they reach out to when they need support. Something to think about, especially if you don't have family around. It's great to reach out to other support networks. Also, if you have your child in school and you want extra support, you could ask for a 504 plan, and this will allow your student, your patient, your child to get support, meaning that they get accommodations at school. And this could be that they have excused absences because they are at home dealing with pain, or they're at an appointment having a procedure done, or that you are able to maybe use a bathroom that other kids are not using. Anything that you feel like would be helpful when your kid goes to school. And also, also look into mental health support at school. This is something that is really great for kids since it's available for them at school. So it could be an easy way to get some mental health support. And then for the families and patients who are working, looking into Family and Medical Leave Act to see what you are able to do when you do have pain or you do have to leave to go to the hospital because of symptoms that you have, and for families to know how much time that you can take off to join your loved ones in the hospital. It's just a good way to be informed of what options and rights you have. Okay, and then that portion is done. I have here in front of us a patient that I have worked with, our whole team at UCSF have worked with. So his name is Eddie. He's on our panel tonight, and he's going to share a little bit of what he has gone through. I think literally everything I've touched on, everything that Dr. Perito has touched on, this is something that Eddie has gone through his whole life. He is now 14 years old. So I'm going to stop sharing here. And I'm going to have Dahlia, if you want to come on and share your story or Eddie's story, if Eddie wants to talk, that would be great.
Hello.
Hi, Eddie.
Hi. So my name is Eddie. I had the TPIAT surgery in 2021, and I had pancreatitis I have the genetic mutation, and I was diagnosed when I was 7 years old after a trip to Mexico. When I had my first attack, my first really bad attack, and I would be, for a while, I would be in and out of the hospital. At first they told us that it was just like a one-time thing, that I probably got a stomach bug or something. And then 2 weeks later I was back, and then 2 weeks later I was back again. And then that's when they told us it was chronic. And then I dealt with it, like I was in and out of the hospital again for like every other month, right?
For the first few years, it started getting, he was diagnosed in 2015. And like he said, the first time they thought it was appendicitis. They did a CT scan and they said, well, it's not appendicitis, it's pancreatitis. I had never heard of the pancreas. I was just happy that he wasn't getting surgery that night for appendicitis. Little did I know. And then he was in the hospital for 5 days and he was discharged. They told us that he would probably never have that again, that it was probably caused by something he ate while we were in Mexico. So we went home and we just continued our life. 2 weeks later, he was in pain again. We went back and at the emergency room, I told him he was here for pancreatitis. And they looked at me weird and they said, no, he's only 7. This doesn't happen to little kids. And I said, he was hospitalized here. But that day, they just sent us back home. We went home and I said, well, we'll try to give you food that won't make it worse. And then I would just give him Tylenol. 2 weeks later, the pain came back. We went back to the hospital. And this time, a nurse recognized us from the last time. And she said, you're here again. Maybe we should, look more into it and get you some help. And I said, yes, please. So that day they did tests for the enzymes and they were elevated. That day, a doctor came and talked to us and said, it's happening again. This is rare. We didn't expect this to happen again. I was referred to a GI doctor at a hospital near home. We were there for 3 years. While there, he was tested for genetic testing, and he was positive for PRES1. While we were there, he would get these attacks, and every time it would happen, the GI doctor would recommend to have a clean out. So he would drink a lot of Miralax. That didn't help. A few months later, I started noticing that Eddie was losing a lot of weight and that his bowel movements were not normal. It was what I was seeing in the toilet was not normal. I remember calling the doctor and letting them know that what I was seeing. And she said, well, it's maybe a stomach bug. And I said, no, he's in pain. He's lost a lot of weight. I'm seeing the food as he eats it in the toilet. Something's going on. So she had some tests done and they called me back and said, yes, his pancreas is not making enough enzymes. So he was prescribed enzymes in 2016. We were there with that doctor until 2018. One night I was, he kept getting this pain and we had no answers and it was just Miralax and more Miralax. I did my research and I found UCSF. And I called and I said, what was the worst that could happen? They could tell me no. I'm willing to go out there and I'm gonna call. I called, I made the appointment, and when we got there, it was on February 8th of 2018, and we met with Michelle and we started talking to her. It was completely different. It was a completely different experience. She knew what we were talking about. And she said, well, we have a lot of options. And I just felt like we were at the right place. Eddie did go about a year and a half without an attack. And we were really happy about that. But in 2019, the pain came back, and it was there for a few days. He would go to the hospital. He was okay for a month or two, and the pain would come back. He started having ERCPs done at UCSF. Those helped for a little bit, but in 2020, it was getting worse and worse. The ERCPs were not helping anymore. I knew that surgery was an option, but it was a really scary option and a very hard decision to make. But at that point, we felt like that was the only option. We were educated. Michelle was amazing. She connected us with other parents. She gave us a lot of information, and, kind of let us make our decision. Eddie had his surgery done February 8th of 2021, exactly 3 years after the first visit. Today, Eddie is doing amazing. We are so thankful to the team at UCSF. I describe it when I tell people our experience as being hugged, because it's not only that Eddie was being taken care of, it wasn't just his pancreatitis, but it was all of us as a family. It was, it's very hard. It's hard to deal with a chronic illness. It's hard. Life still goes on. So when you come out of the hospital, you still have everything else waiting for you. But all I can say is that we are thankful. Today, Eddie is doing amazing. He is off insulin. He's been off insulin since 7 months after his surgery. He eats, he plays soccer. He's doing amazing in school. He's happy, and I am happy, and we're just thankful.
Thank you guys so much for sharing your story. It's so nice to see you because he's doing so well. We don't get to see you that much anymore.
Yeah.
But I think that story of, of how much you can go through and of hope is so important for other families living with chronic pancreatitis to hear. We really appreciate you sharing your story. And I have to say that I think a big reason why our team looks like it does is because we have had the privilege of learning from families like yours about what you need and how it is to go through this, and what, we're always trying to sort of do better with the way we care for folks. But I think having the hope of there is, life both with and after pancreatitis is a really important message. So thank you guys so much for sharing.
Yes, there is. You just have to be at the right place with the right people.
And hopefully what we can do through events like this is, be able to sort of spread the importance of having a multidisciplinary care team and being able to offer all these things to lots of other centers and other families. Because we, ideally would like everybody to have access to this kind of care, or at least know that it exists, and think about how, hopefully if you don't have a team already, that you can work towards getting that, to really try to optimize health and life and make it so that your pancreas is not in charge of your life anymore.
Yes.
Okay. I think for timing, we have to wrap up. But we really appreciate everybody's time and insight and great questions tonight. And thank you so much to the National Pancreas Foundation for hosting us and for working with us on figuring out, ways to make life better for patients living with chronic pancreatitis. We obviously have a lot of work to do still, but we are optimistic about the future. Thank you, guys.
Thank you so much. It was so great talking to everyone. I hope it was helpful. Great.